to this edition of Supervisor Spotlight. My name is Angie Carpenter, supervisor of the wonderful town of Islip, and we are very blessed in the town that we have two first-class heart institutes, really, but healthcare institutes, both South Shore University Hospital in Bayshore and Good Samaritan University Hospital in West Islip, and both have very robust cardiology departments, and we're blessed today to have with us Dr. Harold Fernandez, who is with Northwell. And so tell us a little bit about yourself. I'm always so intrigued. How does anybody get into medicine? How long have you been doing this? And what brought you to the specialty of heart?
Yeah, well, thank you very much for the invitation to be here. And actually, you know, we were conversing before, and it's really an honor to be here with the first female supervisor of the town of Islip. So
thank you.
So thank you for the opportunity. I've always wanted to be a doctor. In fact, and I think that from the time I was a little boy growing up in a very humble town in Medellin, Colombia, I would see doctors and nurses just come to my house, do house visits, and help my grandmothers. And I always wanted to be able to do the same thing for other people.
Oh, that's great.
I also really loved working with my hands, fixing bicycles and just sort of trying to fix different things around the house. And I think it was that combination of wanting to do something with my hands and wanting to help other people through medicine that sort of led me in a direction towards doing something in medicine, and especially something in surgery.
Right.
And now heart surgery, which is a very technical field. We fix the heart, we fix problems within the heart. But that's what brought me to this interest that I have in medicine. I've been doing this for a long time now. I spent about 12 years at St. Francis Hospital, then sometime at Stony Brook, and I've been with Northwell now for about 7 years.
Wonderful, wonderful. Well, as I said earlier, you mentioned St. Francis. Obviously, they have a very robust heart program there, and so does Northwell.
Yes.
And I don't know if are you at South Shore University
That's
Hospital?
Right. South Shore.
Yeah. So, and their rehab department is, second to none. So, as I said, we're really very fortunate here in the town of Islip. February is Heart Healthy Month, so it's really very fortuitous that we're talking about this today. And there are so many linkages with heart disease and other diseases like diabetes. And so tell me why that is.
Yes, no, I think you bring up a really important point. And I think that people should use this month to really look at their own health, particularly the heart health, and realize two things. One, that there's something that they can do to make their heart healthier. And two, that something starts with them. It doesn't start with their kids or their friends or even their doctor. It starts with decisions that they can make at home. And I sort of learned this about 7 years ago during Heart Healthy Month, because as the editor-in-chief for MD Magazine, I had to write a letter about the heart healthy nutrition, the ideal nutrition for the heart.
Right, right.
And doing research, I figured out that there is a nutrition which actually can heal the heart, can make the heart better. And it led me to a lot of changes in my life, changes that I now advocate for, that I'm passionate about, and that I recommend to all of my patients in terms of
So you're going to
nutrition.
have to share some of those
Absolutely.
strategies with us. I'm sure most of us, know some of it, but I doubt we know all of it, and I really doubt we all practice it. But, the one thing that you said about it starts with you, and I think the biggest thing that I've heard, not just, with heart disease, but other, issues, when a person says, something just didn't feel right, and I decided to go to the doctor. Don't ignore those signals that your body sends to you, because sometimes you never know, it could wind up being fatal.
Yeah, absolutely. I mean, if you look at the numbers, if you look at the statistics, every 40 seconds in America, someone has a heart attack.
Every 40 seconds. And is the numbers different with men and women?
They're about the same, but what is mostly different are the symptoms.
The symptoms.
You know, you hear the typical symptom of a heart attack as this sort of chest pressure.
Mm-hmm.
Some patients don't even call it a pain, but a pressure like if an elephant was sitting
Like
on their
tightness
chest.
or something.
Yeah, tightness. And it tends to happen when we're active, when you walk up a hill, when we're excited, when we walk, and then it goes away when we stop. That's the typical symptom that we call angina. But in some patients, especially in women, sometimes you may not have that pressure. You may have fatigue. You may have shortness of breath. You may have discomfort radiating to the neck, to the back, sometimes to the gums. And sometimes you may not even have symptoms at all. So that's, as you said, that's why it's important that if you know you have risk factors, you know, things such as diabetes, high blood pressure, your cholesterol is high, someone in your family has had heart disease, that you go to your doctor so that you can get the appropriate tests to see if you have conditions that we can treat.
And I think too the risk factors that you talk about, from what I've read, are really precursors to heart disease, you know, especially high blood pressure. And people, I find, oh, well, yeah, I have high blood pressure and don't think anything of it. It really is serious. It really is serious, you know, and oh, I take pills so I don't have to worry about it. But I don't think that's true.
Yeah, you're right. You're 100% right. I mean, you know, high blood pressure is called the silent killer. And it's called the silent killer because a lot of times you have no symptoms from having your blood pressure being high, unless it's super, super high.
Mm-hmm.
But if we think of a normal blood pressure as being 120/80, a high number and a low number, 120/80. But if your blood pressure is 130, 140, you may not have any symptoms for years. But over time, that blood pressure being high can destroy your heart, your kidneys, your brain, and other organs in your body.
And I would imagine some of that damage that could be done is irreversible. Whereas if you pay attention to it in the beginning, you could probably prevent it from happening.
100%. You can prevent it. The body has an amazing ability to heal. I mean, we know this from the time we're little kids and you get a cut on your skin and whatever, and
right?
it heals. The same thing happens with your heart. The same thing can happen with high blood pressure. But you got to know what to do and how to heal your body.
Well, I think we're going to be hearing some of those tips from Dr. Fernandez. And if everyone would bear with us, we're going to take a little bit of break and we will be back with Supervisor Spotlight.
You're watching ITV, Channel 18, Islip Television.
So we're back with Supervisor Spotlight with Dr. Harold Fernandez from the Northwell System from South Shore University Hospital. And he is a thoracic cardiologist, is that? Or cardiac surgeon. So let's talk a little bit about that. You know, being a heart surgeon, obviously you've done angioplasties, and maybe explain what an angioplasty is. We know what the angiogram is, the test, the angioplasty, you know, bypass surgery. Maybe talk a little bit about all the differences and the steps and the progressions.
Absolutely. So in general, there are three ways to treat heart disease. One is, of course, with medications. When medications don't work and you have an angiogram is a picture of the heart. Mm-hmm. It's a picture of the heart that is obtained in the hospital. It's an invasive test. because they put little catheters and wires either through the groin or through an artery right here on the wrist. And we take pictures of the coronary arteries. We call them coronary arteries because they crown the heart. And with those pictures, we can see if someone has plaque in the coronary arteries. So in people where medications are not indicated, we can do stents. A stent are devices that we deliver either through the groin or through the artery right here in the wrist, and we can open up those blockages. An angioplasty was used a long time ago before we had stents, but now we have stents, so we just put a stent there and open up the artery. That's done by cardiologists. When that doesn't work, then they call me, the heart surgeon. Because for heart surgery, it's actually more invasive. We literally have to open up the chest, the breastbone. We have to get inside. In general, most of the times, we have to put the patient on the heart-lung machine, stop the heart, and then fix the heart. And what we do is a bypass surgery. So we take a vein from the leg, we take an artery from the chest wall, and we use it to bypass those blockages by actually suturing, so that we can bring more blood and oxygen to the muscle of the heart. But those are, in general, the three ways that we use to treat very aggressive heart disease. And, as much as I love open heart surgery, as much as I'm dedicated and passionate about helping people with heart surgery, I know that there are ways to prevent heart disease. One of my heroes in American medicine is someone named Caldwell Esselstyn from the Cleveland Clinic, who says about heart disease that it's almost like a paper toothless tiger, because it doesn't need to exist.
That's
and
interesting.
it can be prevented.
That's interesting. And with some other diseases, that isn't the case. So here with heart disease, if you are willing to put the time and effort in, to eat right,
That's
to
right.
exercise,
That's right.
it's something you never have to deal with.
Absolutely.
So let's talk about, before we do as far as strategies to help ourselves with that, but we talked about the angioplasty, the stents,
Yes.
the bypass surgery. What about something like a valve replacement? What is that exactly?
That's right. So the coronary arteries are on the surface of the heart, but if you look actually inside the heart, there are valves. One is called the mitral valve, the aortic valve, the tricuspid valve, and the pulmonic valve. But most of the times we deal with the aortic valve and the mitral valve. And those valves can leak, so that when the heart squeezes to send blood outside the heart, sometimes they don't close well, or sometimes the tissues get calcified, they get very hard, and they don't open well, and you get stenosis or blockage, either of the aortic valve or the mitral valve. So in those cases, we have to do something about the valves. We either have to repair them or replace them with open heart surgery, or more recently with procedures which can be done through the groin.
So the robotic surgery, is that what you're talking about?
It's called, for example, for the aortic valve, it's called transcatheter aortic valve replacement. So through the groin, we can actually go inside and look inside the heart with special cameras and put in a new valve inside the aortic valve. It's almost like the surgery that Mick Jagger got when he had aortic stenosis. Replacing the valve without opening up the chest, without robotic technology, but going with catheters so that we can deliver a new valve there.
So that has got to be a lot less invasive, and the recuperation and the opportunity for problems to exist during the procedure have to be minimized going that route.
Absolutely. Patients in general go home the next day. As you were saying before, these are all technologies that we have here in Islip. At South Shore University Hospital.
Yeah, it's amazing.
It's one of the most active programs of transcatheter aortic valve replacement in the country. We're happy to offer these technologies to all the patients.
It really, really is amazing. And when you think about you know, in my lifetime, I remember hearing about the first open heart surgery, you know, in Texas, was it?
Yeah.
And to think about now, you know, bypass surgery is so commonplace, it seems like, you know, you could probably name a couple of people, you know, individuals can, of people that they know that have gone through it.
That's right.
And not that it's so matter of fact or routine, but it doesn't rise to the level of terror that it would strike in a person to think, oh my God, I have to have heart surgery.
Yeah.
You know?
Yeah, no, you're right. Now we're doing surgeries on patients that are in their 80s, their 90s, and they do very well. And they're able, you know, our goal is to get people back to their families, to their communities, back to doing the things they love. And with open heart surgery, we're able to do that.
You know, you mentioned, and it reminded me of something that happened many years ago. My father-in-law had heart disease, and he lived in Canada. And he was probably about 65, and I remember him telling me about this, and it kind of altered his lifestyle and everything. And I said, well, why aren't they doing surgery? You know, this is about, I'm going to say about 30 years ago.
Yeah.
And I go, why aren't they doing surgery? And he goes, oh, the doctor said no. And give me the name of that doctor. And I called him up. And I said, you know, I told him who I was. And I said, you know, I understand what's going on with Dad. And, you know, why aren't you guys doing the surgery? And he goes, well, things are different here in Canada.
Oh, really?
Your father-in-law is too old for us to consider doing that kind of surgery on him. It's a little different in the States.
Yeah.
Now, that was a number of years ago. And sometimes our healthcare system gets a bum rap. When you think about what we have to be able to do to keep people alive, keep people healthy.
That's right.
And the procedures that are done here so routinely.
Yep.
And, you know, our healthcare system sometimes gets, you know, a bum rap. And, you know, there are other, you know, countries, one very close to us, and I'm sure it's changed a little bit, but the medicine there, you know, is still pretty much socialized medicine. And
That's right.
It's a whole different thing. They just don't do it.
Yeah. No, I think we need to be proud and we need to be grateful that our healthcare system is one that is open doors. Anyone, even people without insurance, can just walk into any hospital, especially the hospitals here in you know, close to us, and they're going to get state-of-the-art care.
State-of-the-art, and in a very caring and compassionate way.
That's right.
We're going to take a little break, and we will be back with Dr. Hernandez, and he's going to share some of the strategies with us so that we can all be heart healthy.
You're watching ITV, Channel 18, Islip Television.
Hi, this is Angie Carpenter, Town of Islip Supervisor. Welcome back to Supervisor Spotlight. And we're really delighted to have with us today Dr. Harold Fernandez, who's with the Northwell System. He's at South Shore University Hospital. He's a cardiologist and a cardiac surgeon. And we've been talking a lot about the procedures and everything, the symptoms and all. But you kind of hinted at it. There's a lot we can do to prevent, you know, laying on the table, having a bypass. So let's hear about it.
Yeah,
what are some of the
absolutely.
things that we can do as individuals?
Yeah. You know, it's funny because you would think that what I'm about to tell you is new information, but it's not. 2,500 years ago, Hippocrates, the father of medicine, said that let food be thy medicine and medicine be thy food. And that stands as true today. There's already so much evidence that shows that those plaques that we were talking about before, those plaques in the coronary arteries, can be healed, can be prevented, or can be made better with a whole food, plant-based nutrition. Not vegan nutrition, but a healthy vegan nutrition which is low in oils. And there are already studies from the Cleveland Clinic, from University of San Francisco, where they have shown with these pictures, with these angiograms, that you can reverse plaque. And the reason this is important is that we know that plaque starts early. In fact, in 1953, there was a study of Korean soldiers who died in the Korean conflict, American soldiers, who were ages 18 to 27. And these were autopsy studies. They looked at their arteries, and 100% of them already had the beginning of plaque. And in fact, this is something we all learn in medical school.
Wow.
We learn that plaque begins early. It begins in your 20s. And almost 80% of those soldiers also had plaque in the coronary arteries. So what we need to be talking about is how to heal those arteries, how to treat those arteries that are already diseased and have plaque. And with a whole food plant-based nutrition that is rich in fruits, vegetables, legumes, and whole grains, you can heal these arteries. And the important thing is that, if you think about plaque in arteries, it doesn't just affect our heart. It affects our arteries that are here in the neck that give you strokes when you have strokes.
Right.
It affects
so
the arteries.
There's such a linkage, right?
Everywhere, the entire body. Even right now, for example, Alzheimer's disease, which we know is caused by these plaques in the brain, we're now beginning to see that in the small arteries in the brain tissue, there are plaques, and is now going to be categorized as a vascular disease as well.
Oh, wow.
Yeah.
So the plant-based doesn't mean that you have to be vegetarian. You can have some meat, correct?
So it means you have to be even more than a vegetarian.
Okay.
Because the vegetarian diet is good, it's healthy, but it still has dairy, and it still has eggs, for example. And the most common source of saturated fat in the American diet is dairy, things such as cheese, milk, and eggs. And particularly saturated fat and cholesterol, which comes from animal tissues, from steaks, from chicken, from fish, all these things are high in saturated fat, cholesterol, and they lead to the causation of those plaques. So, some people see as a very drastic change, and what I tell my patients, I tell them graphically, look, this is the typical American diet. This is what I used to eat before I changed. Everything in moderation, because, we all try to eat healthy.
Right.
But this is what leads to plaque. This is a perfect diet. So I tell patients, you don't have to be here. You can be here. And being here is better than being here.
Exactly.
So if you look at our diet, my diet, for example, before I changed, it was typically, bacon, egg, and cheese in the morning, a ham and Swiss for lunch, and then a steak dinner at night. So that's 3 times a day that I was eating highly inflammatory meat products, animal products, and over the years, this catches up.
Oh, sure.
And it causes those plaques that damage our arteries.
I think, too, we want to eat healthy. People are always obsessed about how they look and wanting to lose weight and keeping a good weight. But I find that if you can think of it in terms of doing a good diet, eating a good diet to be healthy,
Yeah.
The spin-off effect is that you're going to weigh less and be at a healthier weight and look better. But, you're going to not have to deal with some of the issues that you would have to if you were going the other way.
Yeah. One of the stories that I share with a lot of my patients, or when I give talks to the community, is the story of the doctor William Kempner, who in the late 1940s came from Germany, escaping. He was Nazi. He was escaping Nazi persecution, and came to the South. And he had many patients with really high blood pressures. And at that time, there were no medications for high blood pressure. And he treated those patients with a diet high in rice and vegetables and fruits. It's called the rice diet. You know, anyone can look it up on the internet.
Mm-hmm.
But with the rice diet, you can actually heal high blood pressure without medications, without any other interventions.
Wow.
Just avoiding the animal products.
So is that white rice or brown rice?
You know, he actually used white rice. I think, you know, brown rice is obviously healthier, it's less
Yeah.
processed. But he used white rice because it was cheaper and because it was more palatable.
And if he was in the South, it was probably, you know, a staple of everybody's
That's
diet
right.
down in the South.
That's right.
Yeah.
But, you know, the point of that is that obviously we can do better than a rice diet, you know, because a whole food plant-based diet doesn't necessarily mean just salads. You know, it means a balanced diet that includes fruits, vegetables, legumes, you know, all sorts of beans and
Yeah.
lentils and
Black
whole
eyed
grains.
peas.
Yeah.
Yeah. So some.
And it works, you know, because I can tell you that, for example, in my case, my blood pressure was beginning to sort of be a little bit higher.
Mm-hmm.
And I also had really bad allergies that went away once I gave up dairy and
That's interesting.
you know, other meat products. And I think people in general will feel much better.
Well, you certainly have a lot more energy, I think, when
Yes.
you have a healthy diet. I mean, the classic example is how people feel on Thanksgiving
Yep.
when they have a big meal and everybody's ready to take a nap after dinner because, you know, they've had just too much. But what about the exercise? How rigorous does that have to be, or can it be moderate walking?
I think it doesn't have to be rigorous. It just has to be, you just have to get out there and move. And
yeah.
what I tell my patients is, you know, half an hour to 45 minutes, 3 to 4 times a week, where you go out there and you move. You walk. If you feel better, you walk a little bit faster. But the important thing is to move.
Well, I find that using a step, you know, a step tracker makes all the difference in the world. You really can motivate yourself,
Yeah.
you know, to keep moving. And as tempting as it is to always go for that close parking spot, and I'm guilty of that. I'm always in a rush.
Yeah.
But if you can make yourself go to that further spot and
That's
walk
right.
a little bit more, you're getting those steps in. Well, Dr. Hernandez, I can't thank you enough for sharing that with us. And we are going to try to eat healthier, exercise a little bit more, and again, pay attention to what your body is telling you. Thank you so much and
It's been a pleasure.
for all that you do.
Thank you very much.
Okay.
Appreciate it.
And we'll catch you next time on Supervisor Spotlight.